Hello and welcome to the Empower Her Collective show. I'm your host, Dr. Celia Corbo, entrepreneur and licensed chiropractor. Join us on our guest speaker episode as we dive into stories of remarkable women making a difference and transforming their lives into reality. Today on the show, we have Lynn Schulte from the Institute for Birth Healing. Lynn is the founder of the Institute for Birth Healing, an educational platform for practitioners, and Center for Birth Healing, which is her clinical practice. She has been helping thousands of moms heal from all issues women experience after birth and is now teaching courses to body workers to help them do the same. She found a common birth pattern that shows up in the pelvis after birth and knows how to release these patterns effectively. Knowing we are more than just our bodies, Lynn works on all levels, physical, energetic, and spiritual, with women to help them access their full potential. Hey, Lynn, how are you?
Hey, good. Thanks so much for having me.
Of
So,
course. I'm so happy that you're on the show. I'm so excited to dive into today's conversation. Tell us a little bit more about yourself, how you got into this world of pregnancy and helping women pre, post, and all the good things.
so I've been a PT for over 30 years. I stopped counting at 30. I have done almost everything, all different kinds of aspects of PT. And my family and I moved from Seattle to Boulder, Colorado back in 2008. And I had to start my practice all over again.
Oh, wow.
And I hooked up with a woman who owned her own maternity store, helping
Mm-hmm.
moms, with all things postpartum and breastfeeding. And I started teaching classes at her store to her customers.
Mm-hmm.
And that class was about how to heal the belly after birth. And I started seeing only postpartum women in my practice, which
Mm-hmm.
I think is very unique for most providers, because most providers, you see a little bit of everything,
Yeah.
right? You see women from all life spans, the age span there.
Mm-hmm.
And just seeing postpartum women allowed me to start to see patterns. Like
Mm-hmm.
everybody showed up, had the same rotation of their pelvis. Everybody showing up had this, like the same, it was same. There it is again. There it is again. There it is again. I kept saying.
Yeah.
And I figured out what was going on. And I was getting women out of pain that were in pain for months. And they'd
Wow.
been seeing chiropractors, PTs, massage therapists for months and still having the same back pain. And they would
Mm-hmm.
see me, and in 5 minutes, that pain was gone. And they were like,
Wow.
whoa, I know, right? Because I was actually feeling what was going on in their pelvic bones.
Mm-hmm.
And I remember early on going, why would this bone be in this position? And
Mm-hmm.
like, doesn't the baby just come right out the middle? Like, that's what I thought happened,
That's what
like
I thought is happening.
it doesn't. And
No.
so I like, why am I finding this in the pelvis? And so I started looking at birth books and, like, what's happening to the pelvis as we birth a baby. And
Mm-hmm.
I realized, and then I put two and two together, being the PT and knowing biomechanics and everything, I realized that it depended on the position a person was in when the baby came out, how it was
Mm.
affecting the bones of the pelvis.
Oh, wow.
And I realized that the bones of the pelvis aren't going back to their original position after birth, that they're actually getting stuck in what I then coined the open birthing pattern in the pelvis.
Huh.
And so the sacrum has to lift backwards to go into flexion in order for a
Mhm.
baby to be born.
Mhm.
And that can get stuck there. It can also deviate to the side as well as it
Mhm.
comes back. So there's two different patterns to the sacrum. But then the ischial bones have to splay apart out to the side in order for a baby to come on out. And it depends
Right.
on what position a person is, whether both sides get splayed out or whether one gets more splayed out than the other.
Mhm.
And when the bones are in this splayed out position, the pelvic floor muscles are on stretch,
Yeah.
and they can't function as well.
Mhm.
And what I realized is that most pelvic floor physical therapists are not addressing the pelvis.
Yeah.
They haven't been taught that. And
Mhm.
or if they have been taught, a lot of times we're just looking at this anterior posterior rotation of the ilium.
Mhm.
Might be addressing in flare out flare of the ilium or maybe
Yeah.
an upflip. but nobody's addressing the ischial splay that happens after birth. And nobody's addressing, well, I don't know about chiropractic, but I know PTs are not addressing the flexion of the
Yeah.
sacrum post-birth.
Yeah.
And that, when I started addressing the bones of the pelvis, I was getting moms out of pain in one session. And
Wow.
yeah, and they would stand up and go, oh, that feels so different. That feels so much better, because this open birthing pattern is very unstable.
Yes.
And so that, that they're feeling, they're having to like tuck under to help create stability in their pelvis.
Mm-hmm.
And so I started finding other common patterns too in my mom's, and I was having some women come in because they couldn't take a deep breath. And I found that their stomach and their liver were getting jammed up north towards the head, because the baby was either using it as a punching bag or was pushing it up.
I've heard that some organs can shift around when you're pregnant. Is
Yeah,
that true?
it is. Yeah, because
Okay.
the baby, the uterus has to expand. And so the
Yeah.
small intestines have to go somewhere. And they usually
Yes.
go
Yeah.
behind. The large intestines kind of stick behind, they go behind. But
Mm-hmm.
depending on where the baby is and the length of someone's trunk from pelvis to
Mm-hmm.
rib cage also determines how much a baby can get stuck up underneath the rib cage and pressurize things north towards the head.
Right. Yeah.
And the liver is directly connected to the diaphragm. There is no fascial, there's a bare spot between the
Mm-hmm.
liver and the diaphragm. And so if that is jammed up, it's going to impact the diaphragm's ability to function well. So that the diaphragm can get jammed up, and then it's hard for a person to take a deep breath. So I had a mama who carried twins, and she carried
Oh.
one twin directly underneath her rib cage sideways. It was transverse in there.
Oh.
And
Wow.
for 2 years, Celia, 2 years, she could not take a deep breath.
Wow.
And she came in to see me, and I was able to release things and bring it all back down. And I saw her the next day, and she's like, I cannot believe I'm not hyperventilating, because I can breathe for the first time in 2 years. And I'm
Wow.
like, wow, that's crazy.
That is
Um,
incredible.
yeah, I've had people fly in from California and different parts of the country because, these women that have this stuck diaphragm, their MRIs are fine, their CAT scans are fine, their doctors have no idea why they
Everything's
can't.
fine.
Yeah,
I hate
exactly.
that word.
But they can't breathe, and
Yeah.
it's because things are restricted in there. So,
Yeah.
so that was another pattern that I found. And then intravaginally, this is the bladder gets smushed off to a side as the baby's head comes through. I can
Mhm.
find the cervix anywhere intravaginally after birth. And it can just cause problems in there. And one day I was actually working, and I was assessing the pelvic floor muscles, and I heard my inner voice, intuition, whatever you want to call it, my guides said, check out the bladder. And I was just like, what does that mean? I'm
Yeah.
like, okay. So I'm like, well, the bladder is at the end of the urethra here. So let me see, what do I find? And that's when I discovered that the bladder was smushed off to the side. And I
Mhm.
helped bring it back into position. And I noticed that there was an immediate change in the pelvic floor muscles.
Oh, wow.
Yeah, the function. They
Yeah.
became softer. They were stronger.
Mhm.
So it was so interesting. Then
Mhm.
I figured out more about working with the cervix and getting good mobility with the cervix, and even that makes a better change in the pelvic floor muscles. And so I kind of, started doing this way of working intravaginally that I taught myself, and I started noticing that the pelvic floor muscles got much better after
Mm.
one session. Like someone would come
Wow.
in and maybe 20% of their muscles were able to fire.
Mhm.
And by the end of the session, we're at 80, 90%.
Oh, wow.
One session, 1
That's
hour.
amazing.
Yeah. Yeah.
Yeah.
So what I started doing then is, I'm like finding all these patterns. So I started putting
Mhm.
them on YouTube, and I got asked to come speak at a Russian conference on birth from these
Mhm.
videos. I've got emails from moms all over the world saying, oh my gosh, I have exactly what you're talking about. Do you know who can help me? And I was like, yeah, not really.
I can.
Right. But I can't see every single woman
I
in the
know.
world,
I
right?
know.
So then in 2016, I realized that I needed to start teaching what I know.
Yeah.
I founded the Institute for Birth Healing and started teaching other body workers, anybody with a license to touch, how to
Mhm.
work with the pregnant postpartum body. I started with my postpartum course, and then I added my pregnancy body. So a holistic treatment of the postpartum body course, holistic treatment of the pregnant body course. And those
Mhm.
were two foundational courses. And then from there, I started adding, I have a midwife course, I have a doula course. I have an intravaginal course. I have a pelvis course,
Mhm.
and then I have an advanced course. And so I just created all these courses, and now I am teaching others and traveling the world. And I was trying to do it all under one umbrella under the institute until
Mhm.
people told me that my website is for moms, and I was like, no, I want it for practitioners. So that's when I had to separate my two, and create another. It's under the umbrella of the institute, but the Center for Birth Healing is my clinical practice. And so,
Mhm.
and it really was, I've been doing this since 2016, but it really was only a couple of years ago that I realized, I'm like, oh shoot, I'm actually running two businesses. Huh.
Yep.
Okay.
Yep.
I have a clinical practice that I'm running, and I have the institute, which is my educational platform. And so yeah, it's a lot of work,
You
but I
know
love
what though? It sounds like such an amazing line of work to be in just because the
it.
results that you get with your patients is incredible, especially because I myself don't really deal with pregnancy in my practice, but I do once in a while get that pregnant patient come in and
Yeah.
just the way that their body is during pregnancy, it's so different. And
Yeah.
there's not a lot of research. There's everyone has a different experience with it. So the fact that there is this safe haven that people can find to, get understood is massive, especially because it's not forever. It's 9 months, right?
Right.
Yeah.
Yeah. And there is, I know, if I look back in my career, early
Hmm.
on when I had a pregnant person, I was like, "Ooh, what do I do?
Yeah.
I don't want to hurt the baby. Am I going to hurt the baby?"
Yeah.
And it's taken me, all these years to figure out, oh, this is what I can do, and this is how I can support a pregnant person. And
Right.
so important that we help pregnant people understand that
Yeah.
if you want a smooth birth and you
Hmm.
want your baby to come on out as easily as possible, it's
Yeah.
imperative that you get some body work, that you get your body assessed,
Yes.
and that we focus in on the baby's position. We focus in and help someone to learn how to effectively push,
Hmm.
because that pushing is critical. And a lot of women are actually contracting when they go to push. So they're tightening their pelvic floor
Hmm.
muscles as they try to push the baby on out, which they're fighting themselves.
Yeah.
And they're creating more resistance for baby to come on out. And when I do that, I release the pelvic floor muscles. I call the pelvic floor muscles the stoplight for birth.
Okay.
That if we have red light tone in there, that baby is not coming out.
Yeah.
Like, it's not coming out. We want green light tone in there that has nice spongy give, like I think trampoline, they need to
Yeah.
be like a trampoline and give and stretch and come back. And so that's what we want in there. But
Hmm.
I'll release the pelvic floor muscles, and I have someone on their back with their knees
Yeah.
bent up, and I'm intravaginal, just using glove fingers. And I will ask them to push my fingers on out,
Hmm.
and 80% of the people will tighten,
Oh,
and they
wow.
don't get how to lengthen their pelvic floor on their back,
Yeah.
which is probably 90% of the people giving birth are giving birth on their back.
Is there an optimal position to give birth in?
I hate to say that any position is bad, because
Hmm.
we need to get in whatever position we need to get into in order to
Right.
get the baby out. And everybody's body is different, and it may need a different thing.
Hmm.
I would have to say that, so as far as the pushing, uh,
Hmm.
when someone's on their back, that's the hardest position to learn how to
Yeah.
push. So then I'll get someone on their side, and then they can start to figure out how to lengthen. But
Hmm.
then I get them up on hands and knees, and there's like, okay, yeah, that's a little bit better. But then when we get them up into tall kneeling, then
Hmm.
they really like, oh, that's how you do it.
Yeah.
Because it's the same as having a bowel movement. It's the same as pooping. And
Yeah.
so, in the upright position, how to push out to have a bowel movement.
Yeah.
So then once that we get them in tall kneeling, then we take them back to being on their back, and then they kind of figure it out.
Mm-hmm.
And
Mm-hmm.
so it's just so important that we help moms to understand and figure out how to do this,
Yeah.
because research is telling us that when we get grade 3, 4 tears, it's usually because a woman was reciprocal pushing.
Oh,
And so
wow.
a grade 3, 4 tear is when the tear goes into the anal structure.
Mm-hmm.
And that creates a lot of issues on its own.
Yeah.
And a lot of that could hopefully be avoided if we can help women figure out how to effectively push with
Yeah.
lengthening the pelvic floor muscles. And you asked the question about, is there a bad position? And like I said, I don't want to make any
Mm-hmm.
one position bad, because you've got to get in the best position to get baby on out. I will say, after birth, I do find a side lying
Mm-hmm.
position. Someone was on their side. The side that they're laying on, that part of the pelvis is anchored. So
Oh.
the other side of the pelvis has to take on more of the motion. And so it
Mm-hmm.
creates more imbalances in the pelvis, a side
Would
lie.
it would it be because the side that's not the side that they were laying on, say it's the left side, the right side has to defy gravity at the same time, and that's why, or it's just because of the orientation of the body in that situation?
No, it's that the baby has to come out, right? So the
Yeah.
bones have to widen. Your sit bones have to splay apart.
Yeah.
But if you're laying on one side, that side can't move.
Oh, okay, there we go.
So the
Yeah.
other side has to move more.
More. Oh, wow. Okay.
Right? And so it just creates a little bit more of an asymmetry
Mhm.
between the two pelvis.
Mhm.
They're really two bones put
Yeah.
together, right? Or
Yeah.
three with the sacrum. And so one side is going to then definitely be more out to the side. So,
Mhm.
I have been spot on. You tell me the position you gave birth in, and I'll tell you what's going on in your pelvis.
Hmm. Wow.
There's a lot of people that will birth with one leg bent up,
Yeah.
like if they're in squatting, but then they have one leg up on the bed or one leg up on the chair. The leg that's up, that ischium is going to be more out to the side,
Yeah. Yeah. That's
because
amazing.
we're biomechanists. We should be able to understand the
Yeah.
impact that birth has on these bones, and
Yeah.
nobody is putting two and two together.
Yeah, I find again, I don't know, the system in the United States is probably very similar to that in Canada, but it's very segmented. It's like, I'm the doctor, I'm here to do
Yeah,
hormones, to give birth, and then there's the physiotherapist to do this. There's the chiropractor to do that. And it's very like you have to see so many different people for
right.
one thing, and that gets very confusing and very daunting for patients. So they just kind of say, "Okay,
Exactly.
I'm good. Like I feel fine."
Well, that's, the thing that's happening in birth these days is that we do a great job of keeping mom and baby alive,
Yeah.
but nobody's assessing what I call the birth door.
Mhm.
Nobody's assessing to see if the door can open for
Yeah.
baby to come on out. And
Yeah.
the birth door is the pelvis and the pelvic floor muscles.
Mhm.
And nobody is really checking that to make sure. We're just assuming that baby's going to be able to come on out.
Yeah.
And
You
that Go
Sorry,
ahead.
continue. No, go ahead, go ahead.
So we need to be assessing the pelvis and the pelvic floor muscles prior to going into labor, in my ideal world. Um, and the reason I say that is because I've had clients come in to see me, and this one woman had 42 hours of labor.
Oh, wow.
42 hours of
Oh
labor,
my god, that just sounds like such a long, painful time.
right? And she ended up having a C-section. And so she
Oh
came
my
to see me afterwards.
Yeah.
She really wanted to try for VBAC.
Mhm.
And when I assessed her, her tailbone was at a 90-degree angle to her sacrum. It was sticking straight up, so
Oh
that
my
the
god.
baby's head was hitting
Couldn't
the tailbone. There was
Oh
no
my gosh.
way that the baby could have gotten through.
Yeah.
And I'm like, why did nobody catch this?
Yeah.
Why did nobody even look for this?
Yeah.
We could have saved this woman tons of effort and pain and trauma to
Yeah.
her body.
Yeah.
And that tailbone was not moving.
Yeah.
And so, so that's what I mean by assessing the birth door. And
Yeah.
like I was talking about, red light tone, if those pelvic floor, I had a doula that came to see me, and she was pregnant with her second baby.
Mhm.
And she heard my talk. And so she came to see me, and When I worked on her during her second pregnancy, her pelvic floor muscles still to this day win the award for the tightest pelvic floor muscles I have ever worked on. I mean, we're talking bricks in there, Celia,
Wow.
bricks, and no give, zero give whatsoever. And because I can get into the energetics and the emotional and the trauma and work with the tissues, I'm really good at getting muscles and tissues to relax a lot of times in one session,
Yeah.
not hers. Like it took us 3 sessions to get good springy muscles to
Yeah.
happen in her. And so what happened for her is that in her first birth, she was trying to do a home birth and she got to 4 centimeters of dilation.
Mm-hmm.
And then she stalled and baby couldn't come on out, which
Oh.
the muscles wouldn't let the baby out. She had to go into the hospital, get an epidural, which bypasses the muscles. And
Mm-hmm.
then she was able to have a vaginal birth.
Oh, wow.
And so this time around, she was able to have a vaginal birth without having to transfer because we did the work with the muscles.
That's amazing. And it's so easy to do. I mean, it's easy to do the work. I find it's hard for patients to commit to do the work because it's not an injection, it's not a
Well,
medication,
it's
but the same.
preventative.
Exactly. Exactly.
It's
The
preventative.
amount of time and body pain you're going to save after is
Yeah,
massive.
right.
Huge.
But people don't spend money on preventative.
They
Now,
don't.
they do when they understand more about how it
Yeah.
impacts birth and the baby and
Yeah.
everything. And yes, they are a little bit more willing.
Yeah.
However, to try to market that to
Yeah.
moms, again, there's no impetus for them
Mhm.
to want to come because their doctors, their midwives, they're not promoting it.
Yeah.
And so we need to help get the word out that this is
Yeah.
work that you need to do, people.
Yeah.
It
Yeah.
needs to work on getting this, getting your body prepared prior
Yes,
to going
absolutely.
into labor. It's
Yeah.
important. So, so
Yeah. Can you
yeah.
can you share a little bit more about that prep? Because, a lot of pregnant women, they say, "Oh, I'm pregnant, I can't come into the office." And although I mentioned that's not my niche, I'm like, you
Right.
do. Yes,
Yeah.
absolutely need to come into the
Yes.
office.
Yeah.
But can you like share a little bit more about that prep work before labor and then maybe that I don't want to say prep work after labor, but that post work
Yeah.
after
Post
labor?
work. Yeah. So pre-pregnancy, I say there's 3 areas of the body that I want to assess on. I wish every single birthing person could have
Mhm.
areas assessed and belly, pelvis, and pelvic floor.
Mhm.
So we got to address the belly to make sure that the baby can get in the best position to come on out. So we
Mhm.
need to be looking at the uterine ligaments. We need to be looking at the lower abdominal fascia, the abdominal wall, to make
Yeah.
sure that baby can get into the best position possible and make sure that the fundus is stacked right on top and that baby's head is heading into the inlet and
Yeah.
not into a hip.
Yeah.
So all those, if baby's not in the midline, there's the uterus has to do all this work to get baby there.
Mm.
And so, not all, what people need to remember is that not all contractions are dilation contractions.
Oh.
There's positional contractions. So, there's
Okay.
contractions where the uterus is trying to help get the baby into a better position to come on out.
Mhm.
So, that's why some women can be so disappointed in labor
Yeah.
because they're having all these contractions and their dilation is not happening. That
And
uterus is
that
working.
gets mixed in with like a Braxton Hicks kind of, oh wow.
Braxton Hicks can be just more an irritable uterus, though.
Okay.
Yeah, so irritable uterus, because women can have Braxton Hicks for weeks and weeks and weeks.
Oh wow.
But a irritable uterus is just a uterus that might be having tension put on it from a tight ligament. So
Mhm.
we can address all of that.
Yeah.
But that, the belly and getting baby into the best position possible to come on out is super, super important. And then we have the pelvis, and we need to make sure that the pelvic bones can move and they can open. And there's different shapes pelvises, and the shape of the pelvic inlet is the only thing that we have zero control over.
Mhm.
And different shapes require the babes to be in different positions. And what we need to understand is we need to trust the baby. The baby
Yeah.
knows. The baby knows its environment. The baby is going to go and avoid where it needs to avoid. So it's going to avoid the placenta. So
Mhm.
depending on where your placenta is, baby is going to be away from that because it knows it's its lifeline.
Mm-hmm.
and it's not going to put pressure on that. And then baby goes where there's space. So your baby
Mm-hmm.
is actually telling you where you have tension in your body. Your baby
Oh,
is showing
wow.
you where you have tension. And the other fun little fact, Celia, is some women produce this linea negra, which is the brown line that goes up their belly,
Yeah.
and it should be directly vertical. And if
Mm-hmm.
that line is pulling off to one way or the other, it's showing you where you have tension in the body.
Oh, that's so interesting.
It is amazing. It
Oh
is
my
so
God. The
fun.
body's just so cool.
I know. It is. And when we don't realize this, it's just like, oh my gosh. Yeah, I learned that
Yeah.
from Gabrielle Brennan down in Australia. She's a midwife who also does body work. And
Okay.
and she's the one that pointed out all these different lines and what they mean and everything. And I'm just like, oh my God, it is so true. It
Yeah.
is spot on
Yeah.
exactly where there's tension in the body. So we need to address those tensions so that
Yeah.
then baby has the space to get into the best position to come on out. And then the
Mm-hmm.
pelvic bones, we got to make sure we can assess, we can have an idea of the shape of the pelvis. Um,
Mm-hmm.
and the biggest issue or the biggest one we want to look at is the arch, that pubic arch.
Okay. Yeah.
If we have 2 or 3 fingers, we want
Mm-hmm.
3 fingers. If we have two
Mm-hmm.
fingers of an arch, that's a way more challenging position shape of a pelvis for us
Mm-hmm.
to come through. So
Okay.
something to keep in mind. Um,
Yeah.
and then the pelvic floor muscles, we got to make sure that they are bouncing, springy like a trampoline. And
Mm-hmm.
that can help, and that we know how to lengthen during
Yeah.
pushing. So
Yeah.
those are, when a pregnant person comes to me, and if they are in pain, a lot of times, unfortunately, our doctors and midwives, they don't understand, well, they don't know what to tell someone who has back pain. So they kind of just
Mm-hmm.
like, oh yeah, well, you're pregnant, you develop pain. And it's like, no, pain is a sign of dysfunction. And
Yes,
we
exactly.
need to get that pain taken care of because the majority of back pain is in that sacroiliac joint, and that is
Mm-hmm.
the hinge for birth.
Yeah.
Sacrum needs to go backwards to widen the inlet for baby to come in, and then it needs to go forward, and tailbone needs to go backwards in order for baby to come on out. And if the sacrum can't do that easily, it's just going to make it a more challenging passageway for baby to come through.
Yeah.
So those are the things that I love to address for pregnancy. And then for postpartum, I like to focus on bringing the bones back together. Like, let's
Yeah.
help the bones come back together after birth, and let's get the pelvic floor muscles to function. So, I focus on, depending on what a person's coming to me, we talked about the difficulty breathing. So, if anyone's
Mm-hmm.
having midline back pain, difficulty breathing, I want to address the thoracic spine and the rib cage and the liver and stomach and the diaphragm and release all that,
Mm-hmm.
and then address the pelvis to bring the pelvic bones back together, and then address the pelvic organs and
Mm-hmm.
make sure the pelvic organs are in their proper place.
Yeah.
And I have an intravaginal protocol that I teach my students to help them to get the pelvic floor muscles to function better, because the biggest issue postpartum is that the core muscles, the two biggest muscles that get stretched out the most during pregnancy and labor, are the abdominal muscles and the pelvic floor muscles.
Mm-hmm.
So a friend of mine said this, and I was just like, oh my God, it is so true and so funny. As a baby comes through the pelvis, it rearranges the furniture of the organs in there. And she says, well, we know kids never put anything back where they belong. And
It starts right from the beginning.
Yep, it does on their way on out. And so helping to get things back into place can help the pelvic floor muscles function so much better, which the pelvic floor, when we activate the pelvic floor, it should draw in the belly.
Okay.
There
Yeah.
should be a connection between
Yeah.
pelvic floor and belly. And a lot of times after birth, that is disrupted. Um,
Mm-hmm.
it is so, like, the belly muscles get stretched out so significantly carrying babies that it's like they get so lazy that they're like turned off. And I put the off in quotes because they're not really turned off, but they're lazy that they need a lot of coaxing in order to
Yeah.
come back on.
Yeah.
And so we want to make sure that the pelvic floor muscle is driving that and pulling the transverse abdominis muscle back up and in, because
Mm-hmm.
don't rehab our abdominal muscles after birth, what ends
Mhm.
up happening is our oblique muscles are muscles that come in from the side. Like if they come in at the angle, you put your hands in your pocket, and then
Mhm.
they come in as your fingers go up towards your rib cage. So they
Mhm.
come in at an angle on the sides, and they're meant to help our our trunk twist.
Mhm.
But if we don't get that transverse abdominis muscle stronger, those oblique muscles become stabilizers, because the
Mhm.
TA's job is stabilization.
Yeah.
The TA, it runs directly front to back. So the
Mhm.
TA gets stretched out more than the obliques do. And
Okay.
so, because they're stretched out more, it's harder for them to come to the party, to activate, to stabilize. And so the body needs stability. It's going to
Mhm.
use whatever it can. And if we
Yeah.
start overusing those oblique muscles, we become oblique dominant. And what happens is we're contracting more at the top, and we're putting more pressures down, and the lower belly goes out. And
Oh.
we don't want that.
Wow. Yeah.
We need to have a bottom up contraction where the TA pulls in, and I call it zipping up a zipper. We
Mhm.
want the lower belly, then mid belly, then upper belly to tighten in
Mhm.
that order, so that when we contract, we're taking pressures away from our pelvic organs.
Okay.
And that oblique dominance is what creates stress incontinence and bladder and pelvic organ prolapse,
Hmm.
because we're just pushing babies. We're pushing that pressure down on those pelvic organs, and that
Yeah.
can cause them to fall out of place and cause prolapse.
Oh, wow.
So, yeah, we wanna avoid all that, and it is
Yeah.
avoidable, yet you need the
Yeah.
rehab after having a baby, to make sure that your core is activating in the way that it should, to
Yeah.
support your pelvic organs for the rest of your life.
Yeah,
That's
we're not done after we have give birth. We have to keep
no.
going.
We do, and that's, the problem with our moms, our mom's
Mhm.
generation, the women that are in their 50s, 60s, 70s right now, is they didn't get any of this rehab after babies. And so
No.
they're like, "Oh, you pee after birth? Oh yeah, you just had a baby, live with it."
Yeah.
And they've had to live with it, and which is
Yeah.
such a bummer, because there is help, there is rehab that can happen, and the sooner we do it after birth, the sooner the easier it is,
Yeah.
because you're not stuck in this, these patterns, and the
Yeah.
body has to force itself to work around these patterns, and it's just
Yeah.
so much more effort for
It's
the
all
body.
the adaptation that's happened
Yes,
over the
yes,
course of that, letting it heal itself type
right.
of
That's right.
mentality.
Right, yeah, and that's, unfortunately, the OBs, they're like, "Oh,
Yeah.
give it
It's
time."
not it needs to be rehabbed, and rehab is so different than regular exercise.
Right, yes,
It's yeah.
because if, the pelvic floor muscles, if like I said, the majority of people that I work with, 20% of their muscles can actually come to the party when I
Mhm.
ask them to contract.
Mhm.
And the majority of women out there are just told, well, just keep doing Kegels, just keep doing a pelvic floor muscle contraction, which is the same as a Kegel. Same thing.
Yeah.
If you're just doing that, you're only going to keep strengthening the muscles that can come to the party. You're not going to get those other muscles that are inhibited because of all
Yeah.
these other things that I've talked about. Scar tissue can cause the muscles not to be able to contract, the bones
Mhm.
being out of place, the bladder being out of place, there's so much that inhibits the bladder, the shock and trauma from the childbirth. We haven't even dove in on trauma,
I know. Yeah.
and the impact that trauma can have on the body is
Yeah.
huge, huge, huge,
Yeah.
huge. And so all of that prevents those muscles from being able to contract fully. And
Mhm.
it's like trying to beat your head against the wall to get rid of a headache. Oh, just keep doing a contraction, just keep contracting. And it's like, no, there's help, guys.
Yeah.
Come get a session, work with one of my practitioners. I have a directory on my website of people who
Mhm.
have studied with me. Unfortunately, not everybody is on that directory, but see if there's people around your area that
Yeah.
know this work and know how to effectively make changes in the postpartum body to get your body functioning better. It's
Yeah.
so important afterwards.
And is there of course, the body is more adaptable, malleable after pregnancy because it just happened and we're not getting stuck in those patterns. But
Right.
is there hope for our moms? Like,
Right.
because I know my mom, sorry, mom, that I'm giving your information, but she dealt with urinary incontinence and she went to pelvic floor and she noticed a benefit. So, is there that ability to
Absolutely.
change?
Yes. Yes. So there is no, you can always heal.
Yeah.
There's one issue though that is not healable, and
Okay.
that is unhealable. That's probably the word I'm looking for, is a tear in the pelvic floor muscles. So a defect.
Okay.
When the pelvic floor muscles, and this can happen in childbirth, the pelvic
Mm-hmm.
floor muscles tear away from their attachment points.
Mm-hmm.
Okay.
Okay.
And that is a defect in the muscles. And that's the only thing that cannot be healed. Well, I guess
Mm-hmm.
that and the bones of the pelvis. So the if a baby gets really stuck coming into the pelvis, and again, this is the importance of making sure we try to get baby into the best position possible. So the smallest part of the baby's head is coming through the pelvis. That's
Mm-hmm.
like when we get baby in a good position and the smallest part of the baby's head is coming through the pelvis, the body can handle that. The
Mm-hmm.
body can do that. And you don't tend to have, if it's a smooth birth, like my births were 7 and 8 hours long.
Oh,
So
wow.
yeah, there was
Yeah.
I had no effects from my birth.
Wow.
People are like, "Oh, did you get into this work because you were so traumatized from your birth?" And I'm like,
Yeah.
"No, actually not." Uh,
Yeah.
but that, when we have a smooth birth, things, recover pretty easily.
Yeah.
However, when a baby gets stuck and the bigger part of the baby's head comes through, we have a baby that comes in occiput posterior, which is the larger part of the baby's head. Like
Mhm. Like
instead
the
of
crown
this part
area.
coming through,
Yeah.
the entire, piece is trying to come through. And that's challenging for the pelvis. The pelvis has to open up extra wide in order for babies to get through. And sometimes those babies get stuck and the pelvis is trying to expand as best it can. And you may hear a pop
Hmm.
during the birth. And the pop can either be the tailbone kind of getting out of the way, or it could be the symphysis pubis joint
Yeah.
separating.
Oh,
And yeah, and
yeah.
if the symphysis pubis joint separates and it tears the ligaments that hold it all together, that is not a fixable event.
Yeah.
Okay,
Yeah.
that's gonna require surgery, and it's just not a good scenario. And
Mhm.
so that's something that, that and the tearing away, the muscles of the pelvic floor tearing away from their attachment points,
Yeah.
those are 2 things that we can't fix. Everything else we can fix.
Yeah.
And then the prolapsing of the organs, that's a tearing. Sometimes that's a tearing away. Sometimes it's just the scar tissue is pulling the organs out of position. So we
Hmm.
need to assess that. And what I tell moms to tell is like, if you feel like you have a heaviness vaginally, if you feel that that tampon is falling out, come get help right away,
Yeah.
because we can get in a pessary,
Mhm.
which can support the tissues. And there's research telling us that if we support those tissues for a year and a half, then those organs can heal in a supported position. And then you don't need a pessary for the rest of your life.
Hmm.
So the
Wow.
sooner you get that support postpartum, the greater chance we have of supporting those structures so that they stay up.
Yeah.
And so there we, getting assessed by a good qualified physical therapist who understands all these things is really important so that we know how to best support you. And there's 2 things I want people to know. And one is that the heaviness. So the heaviness vaginally after a birth is very common because we
Mhm.
just pushed a baby on out. Okay.
Yeah.
A heaviness that gets worse by the end of the day is a heaviness from prolapse.
Oh, okay.
So prolapsing tissue tends to get worse by the end of the day because gravity is making
Yeah.
it heavier.
Yeah.
Okay. A heaviness that stays the same all day long is from the open birthing pattern
Hmm.
of the pelvis being open.
Mhm.
When you bring the bones back together, that heaviness goes away.
Right.
Okay.
And you mentioned with that, the therapy that patients come in for, sometimes it can even be after one appointment. But
Yeah.
is there a muscle memory? Because I find that with my patients,
Yeah.
they come in, they feel better the next day, things tend to come back. So does it tend to go back and then we just need to train the body to get it to that
Yeah.
position?
It depends on how long it's been in the body.
Ah, okay. There we go. Yep.
Right? Like,
That makes sense.
how far after birth are we?
Yeah.
And what I love is that, I've trained some midwives and they're doing this right after birth. And that's why
Yeah.
there are 2 exercises I wish every person who's had a baby would do. And one is the closing the bones exercise. So we can
Mm,
use the abductors and the adductors of the hip to help
yeah.
bring the bones back together again.
Mm,
And so I have the exercise on my YouTube channel. We can put it in the show notes
yeah,
so
for sure.
that out. But
Yeah.
it's just one fist, two fist forearm between the knees. And I have people hold it for 10 seconds so
Hmm.
that they're, we're using a longer muscle contraction to really pull the bones back together. And then
Hmm.
the knees together, shoulder width apart and wider apart, and we're pushing them apart.
Hmm.
And so those 6 positions and using the bones in those 6 ways help to bring the bones back together after birth. So if we
Hmm.
did that right after birth, and then we did the oblique release, so we helped lengthen the lateral abdominal wall. That can help bring the recti tissues back together again and minimize the strain on the linea alba, and that
Hmm.
would help heal diastasis recti.
Ah, okay.
Diastasis recti is a natural adaptation of the abdominal wall to an
Hmm.
expanded uterus. And, research tells us 80 to 100% of women are going to develop a diastasis at some
Hmm.
point. But there's this fine line of between it going back naturally and it not. And so I call it a functional and a dysfunctional diastasis. The
Hmm.
functional, and these are just my terms, nobody else agrees to this with me, but I'm like, what's the difference? Well, the difference is 3 to 4 fingers. So if we have any separation that is 3 fingers and under, I call
Hmm.
those more functional, and they tend to heal on their own within the first 3 to 4 months post birth.
Hmm.
If we get anything greater than 4 fingers and more, now we're in that dysfunctional phase. The linea alba has been stretched beyond its ability to naturally return on its own.
Hmm.
It needs help and support and a lot of extra effort.
Yeah.
And so that's kind of the 3 fingers I have found in my experience is kind of that line that if we're under 3, the body tends to heal those up on their own and it's no problem for moms.
Hmm.
We've got 4 or more, now we've got a lot of more work to do.
Yeah.
So if we can protect the belly and we can hug the belly in and avoid excessive strain during pregnancy, we can keep us more in that functional range.
Hmm.
If we're doing a lot of excessive strain and bulging and doming of the belly, you'll see that when you get pregnant, that sometimes the belly will dome out in the midline. And that's putting strain on that linea alba. The more we strain it, the more it can get stretched out.
Hmm.
We want to avoid that. We want to
Yeah.
avoid that during pregnancy. So
Yeah.
there's, women who love doing CrossFit, and CrossFit can be great if we're doing it in a proper way. And when
Yeah.
we are working with preventing diastasis or healing it afterwards, the key is having a soft dome. So
Huh.
if your belly does dome and you can depress it and there's
Hmm.
not excessive tension on it, then
Hmm.
we don't know fully, we're
Hmm.
here, you should be okay.
Yeah.
But if you are doing a hard dome and you're doing something and you're doming and you cannot depress that dome in, that's putting excessive strain on that linea alba, which may be
Hmm.
causing it to lengthen even more.
Hmm.
That could be taking us into the more dysfunctional range
Mm.
for
Is
diastasis.
Is there an age limit that you see, like, or not limit, but is there an age that you see when it comes to these pregnancies and the way the body heals and all of these things that we're mentioning? Because I'm 32 in a few
Huh?
weeks. And, everyone says, yeah, like it's better to get pregnant when you're younger. Do you see age discrepancies between in the healing process with
Yeah, and
age?
it's really, young 30s were good.
Okay,
Late
thank God.
30s to 40s, we're starting to get
Okay.
the
Yeah.
tissue. isn't as pliable. I mean, look at your
Right.
face compared to mine. Like, you're young and beautiful and I'm in my 50s, and
Yeah.
I'm not doing
Yeah.
Botox. And so, the tissue's more saggy. It's not as responsive.
Yeah.
So around that 40 mark is when we really start to notice that the tissues aren't as responsive to
Mm.
the stretch, to
Yeah.
the recovery. And
Yeah.
so, yes, there is a bigger difference in our older, and I hate that they call them geriatric
I
pregnancy.
know.
God awful word or term for us to ever use.
I know.
But there is something to be said for,
Mhm.
and also another thing that we as practitioners need to be aware of is the stretchingness of different cultures. So
Yeah.
Asian women,
Mhm.
Asian women are at a much greater risk of developing oasis, the tearing down into the rectum,
Okay.
into the sphincter muscle, because of their lack of stretchiness of their tissues.
Oh, wow.
So, have you ever seen, like, Asian women as they age?
Yeah.
They
They
don't
look
look
they look
they
great.
look young, right?
I'm like, "What's your skincare routine?"
But it's not
But
the
it's
skincare,
just the way
it's
that
their
they are.
genetics. It's their
Yeah.
genetics of
Yeah.
their tissue.
Yeah. Yeah.
They do not wrinkle,
No, they don't.
and so their tissue doesn't give as
Mm.
much,
Yeah.
which is a problem during childbirth.
Yeah.
So we as practitioners need to know these things so that we can counsel them and
Yeah.
help them to avoid these grade 3, 4 tears.
Yeah. Yeah,
Yeah.
that's so interesting that you bring that up because, you just think, "Oh, a woman's a woman." It's like, no, like
No.
we are all so different. Our anatomy may be the same, but the physiology, the way things work, our DNA is that dictator and it's different for everybody.
That and, I've always wondered, I'm like, why did I have a 7, 8 hour burst and other women have 30 to 50-hour bursts? Like, what
Yeah.
is that different?
Yeah.
And what I'm learning and assuming is that it's really what a person brings in their body and their mind to the birth.
Yes. Yeah.
Okay. Because that one client I talked about, she brought a 90-degree angle to her
Yeah.
tailbone. And
Yeah.
so there are issues that we bring in our body to our birth that impact our birth.
Yeah.
So, on a physical level, one of the biggest issues I have found is appendectomies.
Huh.
If you have had an appendectomy, no matter when in your lifetime,
Yeah.
that scar tissue is pulling your uterus to the right.
Oh, wow. Because you think, "Oh, I don't need my appendix. I can just get it out." And
It's fine that, you get it out. Yet we need to understand how it's impacting the rest of our
of
body.
course.
And when
Oh,
I
wow.
worked and over the years, I have seen over and over again that if you've had an appendectomy, your uterus is pulled to the right and your baby
Wow.
only hangs out on the right side of your belly.
Oh my gosh, that's so interesting.
And so as pregnant people, we need our pregnant mamas to understand that where their baby is in their belly is
Mhm.
telling of what's going on in their body. So previous surgeries, like abdominal surgeries, car accidents, any type of sports injury that we may
Yeah.
have sustained to our body,
Yeah.
those are all impacting how we're able to carry our babies.
Wow. Yeah.
And so the aches and the pains that we have during our pregnancies is telling us, what we're doing.
Mhm.
And then also, how are we maintaining our postures and how are we using our body throughout our pregnancy?
Yeah.
Because I'm sure you've seen those mamas where they hang out with they just let their belly dangle
Yeah, they're kind
forward.
of in like a sway back
Yes.
position. Yeah, waddling all over the place.
Yes, yes.
Yes.
So they have that tucked under posture. They may even be anteriorly rotated, but they're just tucked under. And one of the biggest things I love to ask my postpartum mamas is if I did not see them during pregnancy is,
Yeah.
did you gain a butt during your pregnancy or did you lose a butt?
Huh.
Okay.
Yep.
And that tells me everything of how they carried their body during their
Wow.
pregnancy.
Yep.
Because ideally, the weight of the belly in the front growing bigger, the glutes have to get bigger in the
Yes.
back that keep us balanced.
Yep.
So
Yep.
you want to have gotten a bigger butt. I remember when I was pregnant, I'm like, oh my God, my butt is huge. It feels
The
so
pants don't fit.
good. What is up with this huge butt? Oh, ugh. But that's a good thing. I didn't
Yeah.
understand it back then. My kids are now 24 and 22 right now. And so back then I didn't know what I know today around pregnancy
Wow.
as part of, but it was a beautiful thing. But
Yeah.
when you lose a butt during pregnancy, you're in that forward leaning posture, leaning Tower of Pisa, going
Mhm.
forward, and your glutes aren't working. And so they
Yeah.
shut down and you lose them. And that is not a good position we want. And it actually can be detrimental for allowing that, helping that sacrum to lift backwards
Yeah.
during birth. So,
Honestly, I see it even with my male patients or like all
oh,
my
yeah,
patients,
yeah,
like you need
yeah,
to work on your glutes. We need to get your glutes to fire because that's keeping you supported,
yes, yeah,
right?
yeah,
Yeah. Yeah.
absolutely. Yeah,
Yeah.
it's so important, so important.
Yeah.
So
Yeah.
there's a lot, and so then those are kind of the physical story. I did have a client that came to see me during her second pregnancy. Her first one ended
Mhm.
up in a C-section after
Okay.
labor, and a labored C-section. And she was getting Braxton Hicks 20, 30 an hour.
Oh my gosh.
Yeah. And when she came to see me and I assessed her, her sacrum was hard only on her left side.
Hmm.
And so I was kind of like, what's going on here? What's happening here? Well, we know the uterosacral ligament attaches into somewhere near the sacrum.
Mhm.
And on days that she would come to see me, I would try to release that sacrum and it would take the tension off the uterosacral ligament and her Braxton Hicks would go down to 1 an hour.
Oh wow.
And so what had happened to her is that years prior, she was playing out in the ocean and a wave hit and she got jammed down. Her legs went jammed down into the floor of the
Yeah.
ocean and it hyperextended her left knee, which jammed all
Oh.
that pressure up into her acetabulum, which affected her sacrum.
Oh my gosh.
So
Wow.
all that force got jammed up into her pelvis. And
Yeah.
so I was trying to like unwind that and release
Mhm.
that. And that
Mhm.
was helping to decrease her contractions. And she was able to then have a vaginal birth.
Oh wow. That's amazing. That is especially because this is the second and there's
Yeah.
scar tissue from the C-section already.
Yep.
That's amazing.
Yeah. So we've got to be able to address what people bring in their body to their birth
Yeah.
because that's going to impact their birth.
Yeah.
And then we also have to think about the mindset too, and
Yeah.
what their beliefs are around birth and what their fears are around birth, because
Mhm.
the fears are going to impact your birth. And,
Yeah.
I've had some mamas who are just like, I didn't want my baby to come out into this world. It's a scary world out there.
Yeah.
And they were, trying to hold them in. And,
Yeah.
or the fear of the pain of birth, or, there's so much that
Yeah.
needs to be addressed. And what I have learned and seen over the years is that you, the thing that you fear the most, if you don't address that fear prior, is exactly what's going to happen in your labor.
Exactly.
So
Yeah.
if
Because you're
you,
manifesting it the whole time because you're thinking about it. Yeah.
yes, yes. And so I get I encourage my mamas and like, please go write down, like if you do opposite handwriting, so you
Mhm.
write with your opposite hand, you have easier access to your subconscious unconscious mind.
Mhm.
Go write about birth, go write about how do you feel about birth, how are you, what do you notice. So
Yeah.
that's super important that we address those fears prior to the labor. And
Yeah. I like that you talked about mindset a little bit. Can we talk a little bit about like that emotional, spiritual aspect that can lead to blockages in the body as well? Because absolutely the physical is no doubt there. But if
yeah,
someone's overstressed or like as an entrepreneur, there's a lot of hats that I wear, a lot of stress that I undergo. How can that impact the body that then can manifest maybe physically or just in a
yeah.
delayed or offset birth?
Well, the stress in our body is really the nervous system is heightened.
Yeah.
Your psoas muscles get activated because
Hmm.
the psoas muscles are meant to be our fight and flight runners. They activate to help us to be able to run away.
Yeah.
And our body is meant to be in this state of calm. And
Yeah.
that when we get activated, then the nervous system ramps up, that psoas muscles get tight, our legs start moving, and we, can now flight.
Yeah.
But what's happening to us in our current day culture is that we are living in these states of stress all the time. And
Yeah.
so our nervous system is amped up, our psoas muscles are tight, and it just decreases our ability of our body to be able to respond even more.
Hmm.
So what's important, we need to remember that as we're pregnant, that our babies are getting developed in our nervous system.
Yeah.
And what we want best for our babies is to have that ability to be calm and to activate. We want their body to have resiliency. We want
Mm-hmm.
them to, it's not about us always being in the state of Zen,
Yeah.
like always being like, like,
Yeah, I'm gonna meditate all day.
right. We're not meant to live in a state of
No.
calmness and
Yeah.
meditate all day long. We want to have that variability
Yeah.
in our nervous system so that our baby's nervous system has that same variability as well.
Yeah.
However, some of us are always at this ramped up nervous system. So then baby's nervous system is being developed to be able to survive in your environment.
Wow. Yeah.
And I'll never forget seeing this video of an ultrasound of a baby in utero. And there's an audio that goes along with it of mom and dad fighting. And every time
Mm.
mom and dad fight, the baby's nervous system startles.
Oh my gosh, I just got chills. That is very powerful.
And it was showing that like that baby's nervous system is getting ready to be
Yeah.
able to survive in this world, in that
Yeah.
world, in their environment.
Yeah. Yeah.
Right. And that's why I was like, oh my gosh, some babies come out so chill. And some babies come out very amped.
Yeah.
It's the environment in which they have to survive in.
Yeah. It's like they're in a fight or flight response, but they can't really fight, so they're just
No,
fighting.
they
Yeah.
have to be able to survive.
Yeah.
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 So
Wow.
so that's the nervous system aspect of it.
Yeah.
And it's super important that we help our clients figure out how to find that variability
Mhm.
nervous system, help them to
Mhm.
find ways to calm themselves down, to get out of that stress, to have moments where we go outside and we connect in with nature.
Yeah.
And, we go be with the trees. The
Yeah.
trees
Hug a
have
tree.
yeah, the trees have their own energy.
Yeah.
And it's a beautiful nature is a very good calming mechanism for us
Mhm.
to help people to connect into more. Um, but then our emotions. So our body is meant to have this fluid flow of energy throughout our body.
Mhm.
And when we have impacts or injuries, and those injuries can be physical, they can be emotional,
Mhm.
they create these I'm going to call them boulders in our body. And those boulders create this it's like think of our body as a river and
Mhm.
that energy is supposed to flow through us. And those boulders, the river has to flow around.
Yeah, it's like a dam. Yeah.
Yes. Yeah.
Yeah.
And we have to, so ideally, if we do our work, we release those boulders and now that
Mhm.
energy can flow more freely through our body.
Mhm.
A lot of us have these boulders and we have these things that happen to us. Now let's talk about the pelvic space.
Yeah.
For women, the pelvic space is the most traumatized area of our body.
Yeah.
You
Yeah.
know, I have to say that any abuse, any type of abuse, whether it's verbal, sexually,
Yeah.
or emotional abuse,
Mhm.
it's held in our pelvic space.
Yeah.
And we have to work around it and we carry that. And, I just worked with a mama who's pregnant with a breech baby. It's her first baby.
Oh, okay.
It's her first baby, however, actually second pregnancy.
Oh, okay.
Okay. So she had a
Mhm.
miscarriage
Mhm.
and she had to go have a DNC.
Hmm. What does
And
that stand for, if you don't mind explaining,
oh
DNC?
gosh, I don't even remember because they're
Put in
Latin.
show notes.
They're
Yeah,
like,
yeah.
yeah, Latin, yeah.
Oh, it's okay, okay.
Yeah, they're Latin words, but,
Oh, okay, okay.
Heritage or something, I don't yeah,
Okay.
yeah, but they go in and they clear out the previous
Oh.
pregnancy
Oh,
from
okay, okay,
so they go
okay.
in and it's a surgery and they go
Mhm.
in so it's if you had a miscarriage, and the body doesn't naturally expel it, they
Yeah.
have to go in and clear it out from the uterine space. So
Okay.
that's what the DNC stands for, but I have no idea
Okay.
what the words are.
I just did an acronym can be so many things, but yeah, the explanation clarifies it.
Yeah, so that's what they're doing in there. But
Mhm.
we had one prior after this baby had miscarried, and so there was, and her second baby or her second pregnancy.
Mm-hmm.
This baby is now 36 weeks and the baby's head is up in its rib cage, up in her rib
Mm.
cage, so it's breech.
Yeah.
And when I tuned into, I was doing intravaginal work with her. And as I tuned into, the energy was shooting that baby straight up towards her head. Like there was this
Mm-hmm.
energy of avoidance in
Yeah.
that space.
Yeah.
And as I worked with her, we had to clear out not only the injury of the surgery, but
Yeah. Yeah.
the grief of that loss of that baby was being held in that pelvic space.
Yeah.
And grief is a very strong, powerful emotion
Yes.
that we hold in our bodies. It can be in our heart, it can be in our shoulder, it can be in our hip, it can
Yeah.
be anywhere in our body, and it impacts the function of our body over time.
I have a patient who had a stillbirth and
Uh-huh.
the grief, like not just with her whole family, but now this patient was a type 2 diabetic, became a type 1, is on opioid medication for the pain. Like the amount of physical distress that she's in from that one event that was so impactful, so traumatizing, it literally manifested all of these diseases inside of her body. And it's the saddest thing.
But it's treatable.
Oh, 100% if the patient wants the treatment. Yeah.
Exactly. If they
Yeah.
go there, if they're
Yeah.
willing to go there. And
Yeah.
that's, like that grief is grief and shame,
Yes. Yeah.
the two strongest emotions that we deal with in our body.
Yeah. Yeah.
And that, grief, any emotion is
Mhm.
meant to move through our body. Emotion is energy in motion.
Yeah.
But our society does not know what to do with grief, doesn't know what
Yeah.
to do with shame. So we just kind of hold it in thinking that, oh, well, this is what I'm supposed to do. And a
Yeah.
lot of times we hold on to that grief to hold on to the person.
Yeah. Yeah.
And if we can recognize that by doing so, we actually diminish our ability to connect into them in other ways.
Yeah.
So we can connect into them on the spiritual realm, on the ethereal realm. They're, like
Mhm.
they have ways of connecting to us
Yeah.
when we're open to it, and we can
Mhm.
let go of them physically so we
Yeah.
can connect in on other planes.
Yeah. Yeah.
So that's, yeah. But grief is just, and that grief was just held in her pelvic space. And so we helped her clear it, and we
Mhm.
helped clear out the energy of the surgery. And, we'll see if babe can now turn down now,
Yeah.
like, and what I also told her that we need to remember as practitioners is that actually we're pregnant, but this is the baby's birth.
Yeah. It's their entry into the world.
Yes.
Yeah.
And there is a reason that they choose the way they come into this world.
Yeah.
We
Yeah.
are the vehicle, but
Yes.
we can't control how that baby needs to come into this world.
Yeah. Yeah.
And so she, and it was really cool for her to embody that.
Mhm.
'Cause there's a difference between the mind and knowing
Yeah.
something and really embodying
Yeah.
something. And so it was really cool when she left her session that she was just like, "Oh, okay, I get it.
Yeah.
Like I feel it in my body
Yeah.
that he is choosing his own way of entering into the world.
Yeah.
And I can do everything that I can to prepare the best way possible.
Yeah.
And there's still maybe something that we don't fully understand that
Yeah.
needs a different way of coming in."
Yeah. There's a beautiful poem by Rumi. I don't know if you've heard
I
of him.
love Ruby.
Okay, there's the most beautiful poem about children, and I was introduced to it a few years ago. And by no means is it about birth or anything, but it's just about the child itself. And, they don't come from you, they just come through you.
Yes.
They are the bow and you are the archer, and you basically are guiding them in your life, in their life, but
Yes.
they are their own person. And my husband and I were talking about this and just about the fascination of the body, one car ride. And we're
Yeah.
like, I'm just a portal for them to come through, and I get to be in their life and guide them and help them make great decisions, but it's their life and it's
Right.
their decisions. And I think as a mother or a future mother or,
Huh?
any kind of mother state that you're in, knowing that I think diminishes the amount of negative emotion that we have, because
Yes.
it's not up to us. They're humans just like you.
Well, see, but that is one of the biggest issues that I find in working with
Yeah.
mamas is that we feel like we have to control our
Yes.
kids.
Yeah.
And
Yep.
we feel like and a lot of control, a lot
Mhm.
of our control is to avoid feeling something.
Yes. It's almost like, again, like you mentioned, that shame. It's like I don't want to feel it. I'm going to suppress it
Yeah,
and put it under the rug, and then boom, we have so many other problems, right?
right. Yes.
Yeah.
And so same goes with our kiddos. Now, one of the hugest aha moments that I had as a parent was realizing that in all reality, there is nothing that I can do to stop something bad from happening to my
Yeah.
kid,
Yeah.
right?
Yeah.
But I can be there to help support them through it.
Exactly.
That's my job.
Exactly. Yeah.
My job is not to stop it from happening in the first place, but to
Mhm.
be there to support them in figuring out how to get through it.
Yeah.
And that was just this huge turning point for me as a mom.
Mhm.
And then when I realized my youngest son, we live in Colorado. It's very cold here in the wintertime and it snows. And this kid would not wear a jacket. He would wear shorts and t-shirt all
Oh,
year
wow.
all year long. And he, I at the door, I one day, he's probably in third, fourth grade at this point in time. And, he's starting to choose his own independence.
Yeah.
And I was like, here, take a coat. No, I don't want it. And I'm like, take the damn coat. I didn't say it,
You're
but I'm
gonna
like,
freeze.
I'm controlling him
Yeah.
to take the coat. And I realized that, and he wouldn't because he's stubborn old, stubborn
Yeah.
fool. Um, so he walks out without the coat. And I stood at the door and I go, why is this so important to me?
Yeah.
And I realized it's because I didn't want the teachers and the other parents to think I was a bad parent sending my
Yeah.
kid to school without a coat.
Your ego.
Yeah.
Yeah.
Right.
Yeah.
Yeah. And as soon as I go, I tried. Like I tried to be a good mom and he's choosing otherwise. So, let's let
Yeah.
natural consequences happen. And
Yeah.
it was just a huge moment for me again to realize that I was controlling him because I didn't want to feel the embarrassment of
Yeah.
other people judging me.
Yeah. Yeah.
Right. And so that's what I was trying to avoid was the
Mhm.
embarrassment of others judging me or thinking that I'm a bad parent.
Yeah.
And if I let that go, I'm like, well, that's their stuff because I know I tried to help my
Yeah.
kid,
Yeah.
do the right thing or, whatever. He was
Yeah.
fine. He never got a cold and,
Yeah.
but it's so important that we recognize, I would say emotions are one
Yeah.
of the biggest issues in the world today
Oh, 100%. Yes.
because
Yeah.
it's emotions are at the center of every addiction.
Yeah.
And the emotions are what we're all trying to avoid by being
Yeah.
on social media and zoning out. And,
Yeah.
there's ways that we avoid all of our emotions.
Mhm.
And what's so crazy is that if we were just to give ourselves the 2 minutes
I
to
know.
feel an emotion, I think there's research that shows an emotion only lasts 90 seconds to 2 minutes
Hmm.
and then it goes away.
Yeah.
And if we can fully feel it for those
Mhm.
2 minutes, it goes away.
Yeah, it's
And
not
it
permanent. Yeah.
no, and it
Yeah.
doesn't have to stay in our body.
Yeah.
And I would have to say the pelvic floor muscles are
Mhm.
the sponges of those emotions.
Yeah, it's catching everything.
It is. It really is. And
Yeah.
that's why I feel as therapist, as a pelvic health therapist,
Mhm.
I feel that by not knowing how to address and work with the emotions in the body is a
Yeah.
huge disservice
Yes.
to those therapists doing intravaginal work
Yeah.
because you're constantly, bringing up and stirring the pot of
Yeah.
those emotions when we go in there and try to release those muscles.
Yeah. Yeah.
And so we need to, and I do have a 9-month long birth healing intensive program that I take
Mhm.
anybody who's willing to do the hard work to
Yeah.
heal themselves so that we can show up more powerfully for our clients.
Yeah.
And that birth healing intensive helps you to learn how to create a stronger therapeutic presence, how to dialogue with our clients' bodies and the tissues
Mhm.
of bodies, because the body, to me, it almost feels like the body has a separate it has a separate consciousness, a
Yeah.
separate level of consciousness. Like
Yeah.
the mind is one and then the body is its own.
Yeah.
And we can deal with it. If you just do cognitive behavioral therapy, you're only
Mhm.
going to be addressing it from the mind
Yeah.
and it's still being held in the body. And that's why when I do intravaginal work and that stuff comes up and they're like, but I dealt with this. I'm like, yeah, from the mind.
But your body didn't release it.
Your
Yeah.
body didn't release it. And the
Yeah.
work, what I love about this body-based work is
Mhm.
that the body can't lie.
No, not at all. Yeah.
Yeah, and so you can learn to pay attention to when the tissues are holding. You were talking about, how does the emotion affect our body?
Mhm.
It can cause held energy, so stuck
Mhm.
energy, like it can't flow. Like
Yeah.
rarely after birth do I feel anyone come in and both energy is flowing down both legs.
Hmm.
Rarely does that happen. Like we're
Yeah.
mainly cut off at our pelvic space.
Yeah.
After I do the work that I do, then people stand up and be like, oh, wow, my legs are heavy. My feet are heavy on the ground.
Mhm. Mhm. You feel
That's
rooted.
grounded again. Yes, they're
Yeah.
rooted again.
Yeah.
Absolutely.
Yeah.
And, and so it's important that we release whatever is being held in the tissues. So I am not a huge fan of forcing a release to happen
Yeah.
because it's tight for a reason. The
Yeah.
muscles are tight for a reason.
Yeah.
Like if the pelvic bones are held open in this open breathing pattern and the pelvic floor muscles are actually trying to hold you together,
Mhm.
and so they've got a lot of tension in them because they're trying to
Yeah.
hold the body together. And as a pelvic floor physical therapist, I go in and I force those muscles to release.
Mhm.
That client gets off the table and their pelvic pain is worse.
Exactly. Yeah. And a lot
Okay.
of people think that's a byproduct of treatment. That like because
No,
even in the consent form, you might feel worse after treatment, but not really. No.
no,
Like, yeah,
no.
you could aggravate something, but what's coming up? What is that emotional level that's
Yeah.
getting stirred that we're releasing that you're feeling right now?
Right. I
Yeah.
had another client. This is a interesting story. So she came in to see me and she had tension in her left pelvic floor muscles.
Mhm.
And so I had my finger on it and I was kind of assessing it and I was doing what I do to try to get it to release. It would not release. And
Mm.
so to me that like if it doesn't release easily physically doing the
Yeah.
physical release work that I did, I know there's something else being held in there.
Yeah.
And as I was doing that, I saw her well up and then just shove it right back down.
Oh no.
And I didn't call her out on it.
Yeah.
And so, I just didn't feel that that was appropriate. So I didn't
Yeah.
call her out on it. And I tried everything that I could. I tried to bring her attention down, figure out what was going on in there. And we ran out of time. And so
Mhm.
I go, well, I'd love for you to come back because,
Mhm.
you still have this tension, this muscle. And she sits up and she goes, ha, my friends told me you were going to make me cry and you didn't.
Well, actually.
I'm like, well, you were going to, but you shut
Exactly.
me down. You didn't call her out on it. But I never saw her again. And I don't
Yeah.
know if she went out to her car and bawled, which
Yeah.
is all those muscles need
Yeah.
is for
Yeah.
you to cry and release it.
Sometimes crying is so therapeutic. I'll just start to cry and everything just feels better, you know?
Right?
Yeah.
But yet in our society, especially out in public, it's
Yeah.
so like you feel shameful if you're crying.
Exactly.
And
Yeah.
I'm so
Seen
bummed.
as a weakness. That's
Yes,
why
God,
it's
it's a
not.
release. It's a
Yes.
release, and yeah,
Yeah.
let's honor it, everybody. Let's honor the tears.
Absolutely.
Yet there's so many people who are uncomfortable being around someone crying, and the worst thing, like when I'm teaching my classes and I'm
Mhm.
doing a demo and some emotion comes up, the first thing that people like to do is go grab a tissue and shove it in the person's face, and I'm like, no,
Yeah.
don't do that because what's the message? Stop
Yeah.
crying.
Yeah.
They're like,
Yeah.
no, we want to release that. Let it honor that. And let
Yeah.
after the release, then we can go to the tissue.
Yeah.
But don't give someone a tissue in the middle of their crying because it just sends
Mhm.
a message of stop.
Yeah. Yeah.
Want it to be released. We need to honor whatever is coming up 200%. The,
Absolutely.
the analogy that I love about emotions in the body is the emotions are like a wave coming up onto the shore.
Mhm.
And that the more we can honor and feel that emotion, the more the emotion can go back out into the ocean.
Yeah.
But when the emotion comes up and we don't honor it, it sinks down into the sand, and that sand is our body.
The heaviness.
The heaviness,
Yeah.
right? And it just like
Yeah.
stays in our body
Yeah.
until we at some point address it and bring it back up so that it can wash back out into the ocean.
Oh my God, that's beautiful.
And
Yeah.
that's what I think there's so much of addiction and drug use and everything is just because life was too overwhelming. It was too much. We
Yeah.
just want to avoid it. We want to shove it down. We want to, not deal with our emotion, or we've never been taught how to do it
That's a huge thing,
effectively.
especially with belief systems,
Right.
that which start in utero, and you're brought into this world with an automatic sense of who you are, and it can be confusing for some people.
Well, the other thing to realize though is what makes it so confusing is sometimes we're carrying other people's emotions.
Oh, absolutely. Yeah.
And
And we don't
especially
even realize it.
no.
Yeah.
And so for me, sadness is one of my biggest triggers because I
Mhm.
will feel people and a lot of us who are in the healing arts are
Mhm.
empaths.
Yes.
We're
We are.
we feel other people's emotions without
Yeah.
recognize them that this isn't mine. And so
Yeah.
sadness is a big trigger for me that I can tune into other people's sadness,
Yeah.
and it'll trigger something. I'll feel it really
Mhm.
fully. And I just had an experience where I was flying and I was talking to this guy sitting next to me about his trauma, and
Mhm.
then later on that day I just kept feeling this overwhelming sadness.
Yeah.
It was just like, okay, I'm like, okay, so I'm going to be with it. I'm going to be with this
Yeah.
sadness and just let it be. But I
Mhm.
couldn't access anything. There was
Mhm.
I couldn't access it. And I was like, well, is this even mine?
Yeah.
And as soon as I asked that question, it started lightning. I'm like, oh, this isn't my sadness. And so I'm like, oh, it must be the guys on the airplane. I recognize. I'm like,
Yeah.
okay, so I'm going to give his sadness back.
Mhm.
And that still kept happening. It still kept happening. And then I realized it was actually from a friend of mine that,
Mhm.
and I was just like, this is hers. So it's not always ours. And if
Yeah.
you were, and one of the most strongest ways that we show up in the world is from our womb imprints.
Hmm.
And the womb imprint is what you experienced when you were being developed in your mom's womb.
Oh, wow.
And remember, our entire nervous system is being developed in the body of your mother.
Yeah.
And so it totally depends on what mom was going through
Yeah.
during that time of her pregnancy with you.
Mhm.
And if mom wasn't feeling okay, then you as that baby, you're going to either take it on, you're going to help her, you're going to give your energy to mom, because if mom doesn't survive, you don't survive.
Yeah.
So you start outpouring all of your energy to help mom survive, and
Mhm.
mom is your world in the womb.
Mhm.
Now you're born with this I have to save the world energy.
Oh my gosh, I think that happened to me.
It
Yeah.
happens to a lot of healers.
Yep. Yeah. Wow,
So
that's
there's
so
a way
interesting.
to when you heal the womb imprint,
Mhm.
especially that I have to save the world imprint, it takes a ton of responsibility off your shoulders.
Yeah.
And
Yeah.
you then start putting the responsibility back where it belongs
Lungs.
on
Mhm.
everybody else. And so
Mhm.
if you are that healer, you are that body worker, that health
Mhm.
practitioner who feels disappointed because their clients aren't getting better, who feels like a failure because people aren't getting better,
Mhm.
you need to look to see if you have that womb imprint and
Yep.
and work on healing it.
Yeah.
And
Yeah.
that's what I teach how to do in my Birth Healing Intensive program. It's my 9-month program that is really designed to help you do your own healing work so that
Wow.
you can show up more powerfully and not have the heaviness of taking on the responsibility for everybody else.
Yes.
You
Yeah.
can give it back to them and only stand in your responsibility for your life.
Yeah. Wow. So tell us, Lynn, then where can we find you on the World Wide Web or in Colorado in your clinic? Because
Yeah.
this was an amazing conversation. I feel like we just scratched the surface of what we actually could have talked
We
about.
could have gone way deeper, definitely, for sure. So I have two websites. I have the Institute for birthhealing.com, and
Hmm.
that is my that's my educational platform. That's where you can find out more about that 9-month birth healing intensive program.
Hmm.
It, I only do it once a year, and the doors are open for registration right now. So if you are a
Oh, great.
practitioner and you would like to learn how to dialogue with the body and dialogue with your clients and learn how to work at that deeper level and how to
Hmm.
release trauma from the body and the emotions and all that. That's what we dive in. So that's going to be on the Institute for Birth Healing, and that's my birth healing intensive program. And all my other online and live courses are there. And then my
Hmm.
clinical practice is centerforbirthhealing.com. And that is, I work out of Longmont in Denver, Colorado, but I also do Zoom sessions. So I can do any of that deep healing work, womb imprint work via Zoom session. So you can reach out to me there for that. And then I'm on social media. Most of my social media is Institute for Birth Healing because I just don't
Hmm.
have time and bandwidth to get the Center for Birth Healing going. That's a lot of effort and energy, and I choose
Yeah.
to go there. So my focus is more towards the Institute because I want to train others in being
Yeah.
able to support moms and support this healing work that really truly is life changing. Um,
Yeah.
so that's my love and focus. But I still love seeing my clients one
I
on one.
know.
So
I could never, as much as I love like the online space and coaching people one-on-one, I just love being in person with my patients. It's
yeah,
just, I don't know, it gives me so much energy. It's just like, it's so beautiful to be with
I
people.
I love hands on too,
Yeah.
and there is very effective healing that can happen at a
Yeah.
distance too. So
Yep.
and
Absolutely.
I love both, but I do prefer the hands-on because
I
just
know.
feeling the tissue and I'm addicted to feeling that release, right?
Yeah.
The tissues just go,
Like,
"Oh."
oh my God. It's such a wonderful feeling.
It is,
It
and so
is. It
is
is. It
it.
is. Well, Lynn, thank you so much for coming on the show. It's been
Oh,
such a pleasure and such an honor to learn from you in this conversation. And for anyone listening, reach out to Lynn if you have any questions or want to learn more about the amazing work that she's doing. And thank you all for tuning in. I can't wait to see you at the next episode.
thank you, everybody.